First myth that I found is your testosterone levels are fine until if your doctor doesn't mention them. So if your doctor doesn't mention your testosterone levels, are they fine?
I mean, it's a good question. Like, what does fine mean? I think the biggest thing that, we're still trying to understand is that what are the signs and symptoms of like low testosterone or testosterone deficiency? It's so variable. And it could be because it could range from what you would commonly think, like sexual dysfunction, like erectile dysfunction, or having a low sex drive. But what if it's mood? What if it's cognition, like cloudiness? So what if it's just fatigue? So there's such a variety of symptoms with testosterone deficiency. So it may not be that your doctor didn't mention it, or maybe it's something they think about, like your thyroid. So I think nowadays we're starting to be more aware of, testosterone related symptoms, and maybe I should get tested.
Yeah, of course.
That's something that I actually, like when I was looking and doing some research on men's health and the clinic itself, you guys actually test that here as well, right? You take blood samples and you can kind of test the testosterone levels through the blood samples here in the clinic?
Not at the clinics. We do just through like the basic lab in the province.
Gotcha.
But that's how you get it tested, right? Just a simple blood test, and what they'll do is they'll measure your testosterone levels just to see if they're low. I think the one trouble is when it comes to any blood test you do, there's reference ranges. But is your reference range going to be the same as someone who's 20 years older than you, someone who's maybe 5, 10, 15? But we use the same reference ranges. So we always have to take everything into context of each individual patient. So if we look purely at, say, testosterone values, I may look at your results and say, hey, it's not red, it's in the normal range. But that may not be normal for you, right? So we do kind of take into that sort of context of like age-specific cutoffs. So that's not really typical. It's, again, something new that we're still trying to understand.
This is something that, in the world of social media, it's been talked about a lot. People like Liver King are coming through. Are you aware of?
Oh, yeah, 100%.
if you're jacked or eating red meat, you got the high testosterone.
Right. And then people are, and also in the bodybuilding world as well, we've talked to some bodybuilders on the show and them talking about steroid use and getting their testosterone levels checked regularly. Is there a certain periodic time, a certain age, a certain time when we should start considering it?
Great question. We have no idea, right? Like, because they're, unlike sort of, say, cancer screening guidelines where, there's robust data to say at what age should you start getting your prostate cancer, your blood test looked at. Testosterone is a little bit different. So should everyone just go for a testosterone check? Well, what if you're asymptomatic? What if you have no symptoms? So we don't know, right? So I think it's more of that if you're having a lot of, signs and symptoms that may lead to, or that you may think testosterone deficiency, or your doctor does, get tested, and that's where we sort of use that. But rather than just sort of blanket testing everyone, we don't know if that's sort of the way to go.
So what are the common signs of our testosterone deficiency?
Yeah, so it could be the sexual side effects ones, or the deficiency. So maybe you're, having some issues with erections, maybe your sex drive, and then we think about like extra, your energy. So having some issues with fatigue, unable to develop poor muscle mass development, cognition, so mood could be altered. Maybe it's cloudiness, so those sort of symptoms.